Now, there are several reasons why you could be watching this video. Maybe you're trying to get pregnant, or you're trying to get someone else pregnant. Maybe you just discovered you're pregnant and now you're panicking, trying to figure out what to do. Maybe someone you love is in this situation, or your interest might be purely academic. But whatever it is, let's dive into the world of pregnancy and breastfeeding and Kratom. What are the consequences? Let's find out. Now the video is split into sections and you can see the sections tagged in the timeline, and these are the topics we're going to cover today. If you're not familiar with Kratom or you're not sure if you have the basics down, you can watch my introduction to Kratom video first, and otherwise let's get into it. Does Kratom affect fertility? Well, of course, before you get pregnant, you need to be fertile enough. Some drugs affect fertility. For example, alcohol lowers the chances to get pregnant or even to get someone else pregnant. But where does Kratom stand in this problem? Unfortunately, studies in this area are fairly limited, and even though Kratom use is generally on the rise in the Western world and kinda common in the Southeast Asian world, we can sort of look at studies done for opiates, but there's a possibility that Kratom can have vastly different effects. First, to even procreate, you should ideally have some baseline level of libido. There has been evidence of long-term Kratom use reducing your libido in the Western world, but this is in sharp contrast with the information that in Southeast Asia people use Kratom as an aphrodisiac, and men even chew Kratom leaves to, perform better. And according to a survey done on Reddit and Twitter male users, Kratom has subjective improvement on one's sexual experience in 43% and negative for 15%. And regarding libido, it was a hit or miss, as 37% of respondents reported increased libido and other 37% reported a decrease in libido. Also, 3 respondents, which is about 2% of the sample, reported a diagnosis of low testosterone levels connected to Kratom use. So we can slowly move to a different question. Does Kratom affect your hormones? And how? Well, of course, it's all connected and your hormone levels are going to affect your libido, but they affect so much more than that. We know that long-term opioid use can cause your testosterone levels to go down. And I found a case study about a 42-year-old man who sought out medical help because of low energy and libido. Now, this Kratom user had elevated prolactin serum levels, and elevated prolactin levels can have negative effects on the function of your testicles, the production of testosterone, and sperm production. The man in question suffered from hypogonadotropic hypogonadism, which is a condition in which your body doesn't produce hormones that would signal to your reproductive organs to produce sex hormones. And hypogonadism basically means your reproductive organs do not work as expected. In women, this could be diagnosed by various issues with your period, and in men, it could be loss of libido, infertility, impotence, and gynecomastia, which basically means that their breasts grow. Now, this man's testosterone levels were down significantly. But in 2 months, when he came back to check in, his levels went back to normal. And this man reported that he stopped using Kratom about a week after his first visit. But of course, you cannot make conclusions based on one man's experience. And also the other 3 guys I mentioned in the Reddit study earlier. A study done on a slightly larger sample of whole 19 men did not find any connection between Kratom and testosterone levels using 3 glasses of Kratom daily, which amounts for 76 to 94 milligrams of mitragynine daily for at least 2 years. But again, this is a small sample. I also found a study suggesting that Kratom could affect sperm morphology and reduce sperm motility, but increase sperm count. So more sperm, but weirdly shaped and less capable of moving. And this study kept the rats on Kratom extract of 50 to 200 milligrams per kilo, so that's much more than you would take as a human. This study was also done to assess short-term Kratom use and lasted for only 14 days. And let's not forget that even though it is possible to find suggestions for humans in animal studies, If something happens to mice or like rats or rodents in general, that doesn't mean that the same applies to humans as well. But to be fair, human sperm does contain opioid receptors, which is the preferred receptor mitragynine interacts with, so more research should be done in this area. And unfortunately, resources are super limited and I found literally no studies done on female animals or human women. But regardless of your gender, if you're planning pregnancy, you should both get off kratom before you start trying. Not only you can be more at peace, chronic kratom use is tied with physical dependency and you ideally do not want to go through withdrawal symptoms before getting pregnant or even when you're pregnant. So let's move to what was supposed to be the main section of this video, kratom in pregnancy. And this section is going to be super short because, surprise, surprise, we don't really have a lot of studies. And about using kratom in pregnancy in rats during the first trimester, which would be 18 to 13 days into the pregnancy for these rats, resulted in a higher incidence of neural tube defects for the babies. These issues were not reported in humans. And from the very few studies we have available, it seems that mothers were able to carry full term. But just because you can doesn't mean you should. And what should you do instead? Should you just quit? Well, let's just say that you've just discovered you're pregnant and you used kratom before. Well, if you just use kratom once or twice before knowing you were pregnant and you're not a chronic user, most likely everything will be fine. Don't stress about it. But if you are a chronic user, you should contact a healthcare professional. Since there's a probability that you are dependent on kratom, there's also a risk of going through withdrawals if you quit cold turkey. And although no such studies were done directly on kratom, opioid withdrawal in pregnancy can affect fetal growth and cause preterm delivery. A responsible physician will either help you wean yourself off or propose a substitution. The withdrawal symptoms include stuff such as anxiety, pileup erection, and diarrhea. And unfortunately, it is entirely possible that you're not from a country where kratom is legal, and admitting to kratom use can have dire consequences. In that case, if there's really no other option, you can try weaning yourself off at home by slowly reducing your dose over time. But if you have any other option, you should probably do it with a professional. Now, if a mother for whatever reason continues using kratom during pregnancy, she is harming the fetus/baby. And once the baby is born, its source of kratom is gone and the newborn baby has to go through withdrawal. Kratom withdrawal symptoms are similar to withdrawal symptoms of opioids: pain, spasms, insomnia, decreased appetite, restlessness, anger, anxiety, and depression. And in babies, these symptoms can be like feeding intolerance, jitteriness, irritability, and emesis, which is just a fancy word for vomiting. And these withdrawal symptoms start about 1 to 2 days after birth, but it can be earlier than that. Now, these babies need to be examined by a medical professional and will probably be admitted for at least the withdrawal period. From what I've read, in the first week at least, the baby is treated with IV morphine and then can be transferred to oral morphine, and the treatment can last anywhere from 5 days to 2 months. And if you are in this situation, please don't lie to the doctors. Of course, this is way easier in a country where kratom use is legal, but keeping your kratom use secret from the doctors can harm your baby. And also, and this is not a common practice, but it is possible to send your umbilical cord to a lab and see if you use kratom in the 3rd trimester. And for whatever reason, we don't have studies about other important topics, but we do have this. Let's just say you got there. You gave birth, the baby is fine, you're in pain, it's a horrible physical experience, and then you remember, well, kratom has analgesic properties. Can you take it safely if you're breastfeeding? Well, unfortunately, there are no studies about whether kratom can get into your breast milk. The American Kratom Association does not recommend using kratom while breastfeeding, and there is some indirect evidence that breastfeeding can alleviate neonatal abstinence syndrome, so it's probably best if you stay away from kratom while breastfeeding. And that's it, we reached the end of the video. Unfortunately, the research is so limited that everything we know about kratom, fertility, pregnancy, and breastfeeding can be summed up in a couple of minutes. And to be honest, I expected to find more, since kratom is widespread in Southeast Asia and its use is on the rise in the Western world. I think it's something that we should know more about. But for now, the general recommendation is that if you're trying for a baby, you should stop using kratom, and if you're pregnant, cooperate with a medical professional on weaning you off. Thanks for watching, see you next time.